Hello, my beautiful people. You're welcome to this episode again. It's me, Dr. ADESANYA Adewale. It's always a pleasure coming here every time to share one or two things with my people. Today, we want to have some discussion in my own terrain, in my territory. But before I delve into that, pause a bit. There is this thought that I had over time that I want to share with you, and I want you to also give me your thought on it. Share your opinion. I'm curious about this. I want to ask a question. Why is it difficult for us as a people to do easy things? And we struggle. We are willing to scale hurdles to do difficult things, when actually doing those easy things take you to a higher level than when you do the difficult things. Am I making any sense? Can I repeat that? Why is it difficult for us as a people to do easy things while we try, we strive, we struggle, we are willing to scale hurdles to do difficult things to achieve certain things, when in the actual sense doing easy things take you higher compared to when you even eventually get to do the difficult things? I am making reference to our health. Easy things like what? Drinking water, lots of water. For adults, 2 to 3 liters every day. Eating fruits and vegetables, doing lots of exercise, and having enough sleep, adequate rest, avoiding smokes. Like, okay, maybe cutting down, if you're the smoker, cutting down, reducing the number of your sticks, or maybe if you're the drinker, reducing your bottles or completely quitting alcohol. Reducing your caffeine. Easy things, readily available, within your reach, not expensive. We find it difficult to do, but we are willing to travel far miles looking for the best hospital in the world, the best machine, the best devices to cure, to help me to be normal, to help me to be stable. Note, a good health is not achieved with 30 days fasting. It's not achieved with 30 days exercise. It's a lifestyle. It's something you imbibe, that you do on a regular basis. A lifestyle, something you choose to do that builds your immunity, that builds your body, physical, mind, and every otherwise. Let me now officially welcome you to my terrain, my area. What makes me a gynecologist, or perhaps an obstetrician, our pregnant women. That is the basis of our existence. We procreate, we expand, we increase the number, we grow and procreate. The kind of care we give ourselves during this period determine the kind of life or the kind of startup we have in life. In essence, I'm talking about prenatal care and nutrition. So we want to look at the importance of prenatal care and nutrition for a healthy pregnancy. Pregnancy is no doubt an exciting time for the mother, for the wife, for the husband, for the rest of the family. At the same time, it requires a careful attention to health. Regular checkup with your doctor and or midwives helps to ensure a problem-free first trimester, second and third trimester. Help to monitor the growth of the baby and ensure a healthy baby and healthy mother at the end of the day. Why this prenatal care? Why? What does it entail? First and foremost, to avoid or to limit your risk when you are pregnant, there are critical steps you need to take. First is to do your pregnancy test. Once you are sure with a pregnancy test you're pregnant, the next thing is to locate the pregnancy. Where is the pregnancy? It's not all pregnancy that are normal. It's not all pregnancy that are safe. In conjunction with your doctor or your midwife, you need to locate the pregnancy with the aid of a scan, ultrasound scan. Depending on your area, depending on your location, you also need to book and register for proper prenatal care. And when do you do that? It's advised at the second miss period, meaning maybe second month, 8 weeks, or when you expect your period the first month, you miss it, the next period that you're expecting that you're missing is the best time to, because by then your scan will be able to establish viability, having located the pregnancy in the right place. So once pregnancy is located in the right place and you have done an ultrasound scan that established a viable pregnancy, you are good to go. Because this first 3 months is a very critical period. That's when you do things or you take things unknowingly that affect the baby, that can lead to congenital malformation, that can lead to the birth of abnormal baby, that can lead to baby that will come out and not grow well, that can lead to baby that will not even get to even develop to mature inside the womb. You can see that every step is very crucial, and what you're required to do is not so difficult. Like I said, the easy things against the difficult ones. In terms of supplement, in terms of nutrients, what do you need? First trimester, most times you don't need more than folic acid. It's a very critical drug. Like I started, easy things and difficult things. This is not the time to look for what will make your baby fine, what will make your baby beautiful, what will make your baby light in skin, the skin fresh, the body to be big, then you start spending excessively on supplements that are really not adding any value or so much. The most important mineral that first trimester is folic acid. Except you are short in iron, or you have low level of iron in your system, then you can add iron supplement, ferrous sulfate. It's a simple one against difficult one. In addition to your supplement, there are vaccines that you need to get that will, immunize you against certain. One of them is tetanus toxoid. This is also the period we start some medication we call intermittent preventive treatment for malaria in malaria endemic environment like the West African region, among other countries. It is also important to learn about safe exercises and habits during this period, and most importantly, above other things, nutrition that are healthy for our mothers, that might even preclude the need for supplements or minerals or the tablets you take. Eating nutritious food is essential for baby's development. You need to focus on proteins like the beans, egg. To focus on iron now, you need your spinach. When you take enough of this, you might not even need to swallow tablets containing iron. And this helps you to prevent anemia while you're still pregnant. We often supplement with iron because you will require more iron than you normally need, your body normally needs, because you're carrying the baby, the placenta will take its own, the baby will take its own, and there is no magic about it. You're going to lose a certain amount of blood, either delivery via the vagina or cesarean section. You eat well, and then you take your iron tablet in addition. For calcium, you all know, for your strong bone and teeth, you need to take lots of yogurt, milk. With those, you're good to go with calcium. See, talking about milk, this is not the time to overeat. I know that I crave for this, I crave for that. You eat little and you eat regularly. Make sure it's balanced and don't eat too heavy. Avoid junks, avoid raw fish, avoid poorly cooked meat. These are things you avoid in addition to the regular ones. Cigarette and alcohol, perhaps. Okay, caffeine. You can reduce caffeine to a particular level, which I know it might be difficult for us to measure. So I will advise we completely stay off caffeine during this period. So drink lots of water, regular, moderate exercise, stay healthy. To our friends, folks and friends, family, this is a period a pregnant woman needs lots of support from the loved ones. So we need to give them a lot of support. My beautiful people, by prioritizing prenatal care and nutrition, you are very sure of giving your baby a very beautiful start in life. I will advise you to drop your thoughts, comment, like, and share this with your loved ones. And always remember to go healthy so that you can save lots of money. Catch you.